One of the big surprises in this year's budget were allocations for the social sector. So while the social sector usually falls in the domain of states, one way in which the union government has been financing it is through centrally sponsored schemes. Despite their problems, and we've written a lot about the fact that they have a centralized nature, their design is not always adept to flexibility. One of the biggest advantages of centrally sponsored schemes, particularly from the state's perspective, is that they're an important source of the non-wage funds to states. And it allows states to direct expenditures towards specific outcomes or specific sectors. There's no doubt that this year, because of the pandemic, there was a need to do a lot of expenditure reprioritization. We saw this in the notifications by the Ministry of Finance early on, which asked different ministries to restrict their expenditures. Exceptions, of course, were made for rural development and health and some of what were considered the priorities ministries during for the pandemic. But at the same time, there was also this announcement that given the pandemic and given the fact that we were going to be heavily reliant on the social welfare architecture, the union government said that it will ensure that its commitments to the social sector will be met in terms of its releases for different centrally sponsored schemes. Unfortunately, the budget doesn't show that, and almost across all schemes, we see dips in budgets for the social sector. So let me give a few examples. I think nutrition is a one big example which has been an important agenda for the current government. And after years of neglect, finally around 2017, 2018, we saw that it was getting priority. But even the nutrition sector has seen cuts in schemes like the Integrated Child Development Services or ICDS. And even in the revised budgets are those that through the year, so for 2020-21, initially at the start of the year, you would have allocated a certain budget. The revised budget is what is closer to the actual expenditure. And this is despite the fact that the Supreme Court had said that the provision of supplementary nutrition would continue unabated, even if it meant that you had to deliver food directly into people's homes. This year, while we don't know the exact actual allocations for ICDS because it's now been merged with other schemes and is called the Saksham Anganwadi and Poshan 2.0, what we do know is that even in the revised estimates, budgets were cut. And if you compare the allocations for this newly merged scheme with ICDS budget estimates or the estimates of pre-pandemic budget, you see that even this revised scheme, which includes 4-5 different schemes in it, the budgets for that are actually lower than what was originally budgeted pre-pandemic for ICDS. Similarly, another important scheme for nutrition is the midday meal scheme, India's school feeding program. And again, interventions from the Supreme Court meant that there was this order that even though schools are shut, the provision of some form of food will continue during the pandemic. And so you had food security allowance being given to children's homes or to parents directly. During the year, what was interesting was that budgets were enhanced. So 2,400 crores were announced at least as additional allocations for the midday meal scheme. Some of it was coming to provide midday meal even during the summer vacations, which typically when schools, since it's provided in schools and schools are shut, it isn't provided and it's provided for 10 months in the year. So additional allocations were given saying that since schools are not open, we can continue to provide it during the summer vacations as well. And then also for enhancing cooking costs. But yet, when you look at the revised estimates, it's lower than this 2,400 crores that was added. So in fact, less has been allocated than was promised during the year. And again, if you look at the current budget allocations, you can't even call it an increase. It went from 11,000 crores to 11,500 crores. During this entire pandemic phase, what has been critical in some ways is the social welfare architecture. I think India has been lucky because we had a lot of these schemes in place. We had Anganwadi workers available right down to the last mile. You could actually deliver and pivot towards COVID and actually deliver food grains or deliver ration to people's homes. And given the heavy reliance, not only were the fact that budgets were cut this year, which means 2021, But even for the coming year, we haven't really accounted for the fact that the social sector has actually played such an important role for us during the pandemic, both in terms of relief, but also to mitigate some of the impact and after effects of the pandemic. The other surprise, I think, and again, this one is a big one, the is NREGA, the Mahatma Gandhi National Rural Employment Guarantee scheme. If you compare last year's figures of people asking for employment with this year's figures, you can see that demand was definitely significantly high. And this is a scheme that's often been under budgeted for. And by that I mean that while every year allocations to some degree have increased, our expenditures are always just higher. And being a act and being a law, it is mandatory in some ways to ensure that employment is provided if it is demanded. And so, what you've seen over the past few years is that because the demand is so high and expenditures time and again are much higher than what is budgeted for, you have this peculiar case where you're actually spending more than you have available. So what the scheme calls, it's called pending liabilities, which is basically payments that are still due, which keep accumulating over a period of time. So when we were doing our budget analysis, for instance, on 1st of January, there was already 11,000 crores of uh, actually there were already over 11,000 crores of pending liabilities that had already accumulated. The other sector that I think has been much in the news has been this 137% increase in the health budget, or so it's, or that's how it's been interpreted. I think it was an interesting way of presenting the health budget because it is a much more intersectoral approach, recognizing that health also requires clean water, also requires nutrition, also requires the health infrastructure itself. But when you again start going into the details, you realize that a lot of this increase of 137% isn't actually coming from core health or direct health expenditure. It is coming from some of these additionalities. A lot of it is coming from the water scheme, Jal Jeevan Mission. And again, it's a scheme that has in the past been underfunded. We had made certain commitments, we have not yet matched them. In fact, the cabinet itself has said that you need to at least spend as much as you have committed to. So it's no surprise that the allocation for Jal Jeevan Mission increased. But I guess the question is, would they not have increased even in a non-pandemic year? What's so different in the health budget that takes into account the pandemic, the both the impact of the pandemic, but also the lessons that we've learned in terms of our public health system due to the pandemic? The lack of allocations to social sector, and I think this is something that we've all spoken about many times. What that means for a year like this year, which is where we are still not fully recovered from the pandemic, is that we're going to see again either a lot of exclusion and increasing divide and inequality, which is definitely something really worrying. Or you're going to see that within schemes, you're going to have to kind of rationalize expenditure. So we've seen this time and again, even for existing schemes, where some of the analysis that we did at Accountability Initiative found that in terms of what is required for supplementary nutrition, we're not even allocating half. And then, so what that means on the ground level is that lots of people who actually should be getting it, it's a universal scheme, don't actually receive things like supplementary nutrition. So it's going to be a little bit of a tough situation for lots of people. I think the fact that employment levels are still low, we know that vulnerability has increased. That is a fear, I think, that in terms of this neglect of the social sector, what that's going to do in terms of the rising inequality and the vulnerabilities of large sections of the population is something definitely very worrying.